Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast is going to bring curiosity, humor, and reflection to the world of palliative care. We are going to explore the joys and challenges of working in this incredible field, including topics related to education, advocacy, self-care, service provision, and leadership from around the world. I'm one of your hosts, Spandana Rayala, based in Kuwait. Today, I'm interviewing Dr. Megan Doherty, who is currently based in Ottawa, Canada. She's an amazing person to know, a great friend, and fantastic pediatric palliative care clinician, educator, advocate, and leader. Let's dive into the conversation. So I know I have been working with you for many, many years. So I was just wondering if you could describe some of your roles for our listeners and how that intersects and also furthers pediatric palliative care.
Definitely. So I volunteer with an organization called Two Worlds Cancer Collaboration in Canada. It's a Canadian charitable foundation, and they're focused on bridging the gap between the cancer care that's available in some more high-income settings and in other places around the world. And they do that mainly through connecting of doctors, nurses, and other healthcare providers to build capacity and work together to solve those tricky, difficult situations in the healthcare system that we all face. So I direct the Two Worlds program on pediatric palliative care. So I work with a team of mainly volunteers, and we all work together. And some of the main programs that we work on is a pediatric palliative care fellowship program, which trains pediatricians across South and Southeast Asia. So we give a lot of virtual training as part of that one-year fellowship, and then some clinical training, some of which occurs in Hyderabad, where there's a center of excellence for pediatric palliative care. Some of the other roles I have is directing ECHO programs and leading our ECHO work on pediatric palliative care, which is like a special particular model of virtual teaching and learning, which uses Zoom. And we deliver a lot of courses in that way. And I'm also involved with MSF as a telemedicine advisor, giving advice on pediatric palliative care and how we can do it for individual cases around the world in humanitarian settings.
You have done a lot of work in humanitarian settings, trying to take pediatric palliative care to those environment. So I'm just wondering, how do you and your team, what is your experience? How did those collaborations happen?
Yeah, so my experience with the humanitarian setting started in 2017 when there was a refugee crisis and many people crossed from Myanmar into Bangladesh, a group of people called Rohingya. They were experiencing violence in Myanmar, so they quickly crossed over into Bangladesh and they settled in refugee camps in that region. And so I was part of some initial work understanding what are the needs of individuals with serious illnesses in that kind of a setting where there's a very rapid forced movement of a large group of people. About 1 million people moved into Bangladesh very quickly. So some of the initial work was going and identifying individuals who had serious illnesses, things like cancer, HIV, advanced heart or lung disease, children with genetic conditions, and things where they need more advanced treatment. And so we were understanding what are their needs, what kind of symptoms are they having, and how do they access healthcare in that new environment in the refugee camps. So that's where it really started for me.
Wow, those are huge numbers and quite different conditions. I would imagine that even after all the efforts you and your team was putting in to reach every child possible, it might not seem like a lot is happening on any given day. So how do you deal with that?
Yeah, it's always hard, especially in the refugee camp settings. You know, we spent in the beginning, even in 2017, it was very hard to convince humanitarian health organizations that they should even consider these types of patients, you know, and think about what these individuals would need. So we were really advocating even just to say, well, there's going to be, you know, individuals with cancer in this refugee camp, and how are we going to manage them? And they would say, oh no, we're much too busy with other things. We can't possibly think about those children. So in the beginning, it was a lot of advocacy about showing that these individuals, these children, these adults and their families have a lot of needs, and also showing with our initial work of actually doing some palliative care in those refugee settings, showing that it was possible to give palliative care. Because that was the other myth that was out there, was that, okay, maybe these people are suffering and they have a lot of needs, but in a refugee camp, people assumed, oh, there's no way you can give them palliative care. There's no way you can really address it. And so we showed that no, you can make a big difference in people's lives just by being with them, visiting them, hearing their story, hearing what they're suffering. And then there are some supports you can give. I've many times shared the example of one of the little patients we cared for who had a bone tumor, and he was having a lot of pain in his leg. And our team being able to visit and bring him pain medications really showed that benefit. And I think sometimes those individual stories have been so helpful in allowing us to share the benefits that can occur with palliative care.
Thank you. I'm just imagining how difficult it must be advocating sometimes when people are not willing to listen, being relentlessly optimistic. And how do you even do self-care when seeing so much suffering, especially in all these innocent children?
Yeah, I think that's such a good point in palliative care. Like, we have to think about how we care for ourselves. If we give too much of ourselves, then, we won't be able to continue this work. And then, even if we started something good and something that's helping people, maybe we won't be able to continue it. So I always bear that in mind, that everything I'm thinking about and everything my teams are building and creating as health programs, that they have to be sustainable, that they have to be something that can continue for the long term. And it's no good in building something that's like super high tech, requires a ton of resources, and then it can't continue either. But thinking about the self-care aspect of it, I think it is about finding meaning and finding purpose and finding kind of a reward for oneself in knowing that you've done a good job and that some of the patients are getting the care that really benefits them, and celebrating those successes. So again, going back to the little boy with the bone tumor, Mojibur was his name. And just, his case was so emblematic in that we were able to get him morphine, which many times is not available in refugee camps. And he really needed that medicine because it was a strong pain medicine and he had really, really bad pain. He couldn't walk. He was just crying and lying on the floor in his shelter all the time. And once we got him the morphine, then he could. And that story for me was really compelling in terms of supporting me to know, okay, we are doing the right thing. This work is helping people, and therefore we should continue. And telling other people his story, also then they'd be like, oh, that's so good. He got help. It really helped him. I can see how he needed it. And that kind of reinforced it for us. So I think that degree of motivation and focusing on the things that are successful and the things that work, and not always just thinking, okay, we can't do it. So many patients don't get the help they need, but actually focusing on the things that do work is really important.
Thank you. I think so much of what you have said resonates with me, and celebrating the small wins. I think that is a tough one, especially for people who consider themselves type A personalities or perfectionists who want everything to be perfect and save the world with every attempt. I think this is great advice. I just heard somewhere the other day that if you're trying to give 100% every time, and as a consequence, you're burning out, that is not going to be sustainable. And if you're able to give your 80 or 90%, but if you're able to keep up the work for a long time, that is more sustainable. So do you want to be 100% in burnout, or do you want to be 80 or 90% and still do the good work? I think we have to choose sometimes. But yeah, thank you for saying that, Megan.
Yeah, I completely agree with that. I think you do have to choose. And I think you have to kind of allow yourself to say 80% is really good. And, before me or before our team was here, it was 0%. So, 80% is a huge win. And I also think about it, many times the programs that we build and we create with the communities, they help people, but I can always see how it could be better. I always think, oh, what about this? We should be doing this. The patients have these needs and we're not addressing them. My response has always been, the next time we do it, let's just make it a little bit better. As an example, with our fellowship program, every year we try and improve one aspect of it. And we say, okay, let's just make this a bit better, how we do this. And so it's these small incremental changes. And if you keep doing that over time, again, you'll get further ahead because you're gradually moving towards where you want to be, and you're bringing the whole team with you. Sometimes the change doesn't happen at first because you as the leader might have a vision for the change, but maybe not everyone else sees that. And so it's about bringing everyone slowly together along the path so then the change can be sustained because everyone believes in it and knows this is what we should do together.
Thank you so much, Megan. And I definitely would like to dig more, but maybe in the next episode in the future, because this is one question that people really wanted to know from you. I have asked a lot of people what they would like me to ask you, and how do you manage to stay positive is what a lot of them wanted to know. So thank you for answering that. One specific curiosity that I have is that you have trained mostly in the West and then you moved to Bangladesh and did some work. So to think of West and Southeast Asia, it's a huge change. And as we become more aware about our work in palliative care, we talk about cultural competency. And coming to specifically death and dying, it's such a sensitive topic. How did you manage developing your own cultural competency and being accepted in a different culture? How did you manage to do that?
It definitely wasn't easy to move from Canada to Bangladesh. And I was a fairly newly graduated specialist at the time when I moved. But I think the thing that guides me in the work is always that it is a shared journey. It is a partnership. And so it's a journey of listening and understanding the partners, and everyone's going to have that experience. So in Bangladesh, I did a lot of listening and just observing and seeing how they were experiencing palliative care, how people in Bangladesh were thinking about death and dying, and then navigating that with the angle of palliative care. And I think some skills that we all have in palliative care is that we know that every individual, every family is different in their approach to death and dying, even within a culture. So that skill of just listening and asking questions with genuine curiosity and saying, well, how would your family like the care to be at this point? Those kind of questions really help me in any culture to understand how people wanted to be cared for. But I definitely did in the very beginning a lot of just listening and watching and asking questions of the palliative care teams in Bangladesh to better understand how they were interpreting palliative care in Bangladesh, in their culture and their country. And I think that is what I do wherever I go, is that I always am much more at the beginning, just listening and watching and kind of seeing how it's working. Although now, of course, I have much more of a scaffold and kind of an idea of some of the patterns that occur. So I kind of know what questions to ask, because there's sort of key things that'll be different amongst different peoples and different places.
Thank you. I have faced a similar situation last year, and I think it helps a lot to observe, as you said in the beginning, and then kind of build on it. And I think the silence that we bring to the space earns us respect in turn, that we are observing them and we are respecting their culture. I think that is the other piece that helps us to be recognized slowly as part of the tapestry of whatever they exist in. I have one other question, especially because you have said you do a lot of education programs, awareness programs virtually. You have a lot of pediatric oncologists, general pediatricians joining in these courses and equipped with this knowledge, which is not the expert level, but more an awareness knowledge. Now they realize what is falling short in their setting, that they're not able to deliver certain things, or they would like to start at some place now. And what would be your advice for those who would start somewhere but do not have the complete expertise to deliver pediatric palliative care?
I think there's a few things to think about. I always think about something that Paul Farmer shared, and he was very involved with Partners in Health, which was an NGO working a lot in Haiti and around the world. But he said, you have to have stuff, space, systems, and staff. Those are the four things you need to do health care. And it's probably not a complete list, but I think when you're starting out and you say, okay, I want to do a palliative care program, I want to implement palliative care, think about each of those things and how are you going to have stuff. You need medicines, you need equipment a little bit, you need space. You actually need physical space and a place to care for patients. You need staff, so you actually need to train and have people on your team. You can't do it alone. We don't want you to do it alone. And then you need systems. This is ways of working, ways so that common problems, you solve them in the same way each time. People have pain, we assess them with a pain scale, things like that. Here's our bereavement protocol. We call people after this much time, we follow up with a visit, etc. So I think that helps at a very basic level to start thinking about how you do a program. But I also think that if you're new and you're starting out, you have to find a community that will support you. We talked about self-care and how it's so important. And if you're doing this work alone in a new setting, you're like striving to implement palliative care and you're all alone and, maybe your hospital's not that supportive and nobody understands what you're trying to do where you are, you will burn out. Not even the most well-intentioned person can do that on their own. And so I think about who's been successful in starting new programs after they've learned a little bit about palliative care. And it's colleagues who have then sought to have a sort of network and a system of people outside of their setting who are supporting them. A WhatsApp group of a few clinicians who also do palliative care who can encourage you when you have a tough day and you say nobody understands it and the oncologists don't want me to come and see any of their patients because they want them all to be cured. Then, that group can encourage you and say, yes, I went through the same thing, and just keep pushing and keep explaining how this will help, and eventually people will see the benefits. So I think those are some really important things when you're starting out. Of course, education also important, and always to be learning more and not be afraid to admit you don't know that much yet, but just be willing to always learn and adapt your practice to the new things that you learn. And there's so many online resources now. There's online courses through the International Children's Palliative Care Network. Those are fantastic. There's 9 modules online. And then there's so many other things in each region. And again, if you have a network of people that you're connected with, they'll be able to share things with you.
Thank you. So to Dr. Paul Farmer's 4S, Megan has added support and study, 2 other S. I have so many more questions, Megan, but I think I'll save them for the next time. But before I let you go, I just want to ask one question, and that is, what advice would you give your younger self about professional life, personal life? You can choose anything, but what would you go back and say to Megan, who was 10, 15 years younger?
So what I would say is don't be afraid to talk less and listen more. I think early on, you're kind of hesitant and a bit shaky in your skills, like you're a bit insecure, but just to have confidence in yourself that you do know things, but that there's so much more to know, and that listening and observing and respecting, like what you talked about, Spandana, that can be so valuable, and you don't have to say a lot to make a big impact. So those would be some of my advice. I think my other advice would be to get more skills outside of just medicine. The skills that I've had to acquire as I've gone along my path and my journey are leadership skills, understanding research, understanding how to advocate and motivate, and how to study systems and how to implement things. So I wish that earlier on I had taken time to perhaps acquire more of those skills and understand different areas outside of, sort of core clinical medicine.
Thank you so much, Megan.
Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from the seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related suffering. To learn more or to donate, please visit twoworldscancer.ca.